Okay, so let's discuss the GLEASON score system. This system is generally responsible to give you the clue, give you the exact grading of the prostate cancer. Okay, if we have a patient is reflecting you all of the symptoms or the predominant symptoms of the prostate cancer, you will suggest a patient to undergo the biopsy, and after the biopsy, you will conclude the grade. Okay, higher the grade, poor the prognosis. Means grade is less, then there is a good prognosis, right? We know this. Now, how you will look at the cells of the biopsy? If the cells is normal looking, then that is normal in size, well differentiated cells, not showing any abnormality. That is 1 and 2 pattern. But in the case of determining the Gleason's pattern, we have to ignore 1 and 2 patterns because this is just a normal cells. And if you find out the cells in the prostate biopsy that they are little bit not well differentiated compared to 1 and 2, so we will put it as a 3 pattern. Okay, we will put as a 3 Gleason's pattern. And after that you look out some cells which is not well differentiated, the nucleus cytoplasmic ratio is really high, like 1 is to 2 and 1 is to 1, like that, then it will be calculated in the Gleason's pattern 4 and 5. Okay, so how you can calculate the Gleason scoring system? By first we will take the predominant pattern seen in the biopsy, like a predominant pattern, like 75% you are able to see the third pattern of Gleason. Then we will add the 3 with the another frequent pattern which is able to see in the biopsy. That for example 75% I am able to see the pattern number 3, by 25% I am able to see the pattern number 4. Then I'll add the 3 plus 4 together, and the answer will be 7, right? So if the 7 is the Gleason scoring, and if the Gleason scoring is 7, this is a medium grade cancer. Okay, this is a medium grade cancer. 7 is a medium grade. Okay, while if the answer, the Gleason scoring is something 6, like 3 plus 6, 3 plus 3 is 6, then the grade is low grade cancer and there is a good prognosis. You can treat the patient, okay, very nicely with the help of medications and all. And if you find out the Gleason scoring is 8, 9 or 10, by adding the 3 by this patterns, then there is a really poor prognosis, and we have to look out with this really seriously with the 8, 9, 10. And so then about the grading groups, if the Gleason score is 6, then this is grade number 1. This is low grade cancer. While if the Gleason score is 7 and 7, then this is medium moderate grade cancer. If the Gleason scoring is something 8, 9 or 10, the grade will be 4 and 5. Okay, so this 4 and 5 is the poor prognosis and they having the high grade cancer. Okay, so with the help of pattern, first determine the pattern, and that pattern will be put in the formula, and that formula is just like a predominant pattern with the most frequent pattern, and after adding we will get our grading score, and after the score we will put our score in the grade group, and we will identify the grade of our patient of the prostate cancer. Okay, so I prepared the 3 set of questions for you to know how to solve the Gleason's scoring. So first question is, we have one biopsy where we find out the 50% pattern 3, 30% pattern 4 and 20% pattern 5. So we know the formula. First we have to put the predominant, that is 3 over here, and then we have to add the most frequent one. So between 4 and 5, the most frequent is 5 because 5 having the poor prognosis compared to the 4. So we will put the 5, and after that we will get our answer that it's 8. Okay, so 8 is having the high grade cancer. So high grade cancer. Okay, now we have another set of question where the 98% pattern we find out 3, 2% pattern 5. So what will be the Gleason score? So 3 plus, now is it we have to add 5? No, because if the 4 and 5 pattern is there and it will be having like less than 5%, so we have to ignore 4 and 5, because it's really less than 5%, then ignore it. Okay, just you have to write the 3 plus 3 and the answer will be 6. Okay, because it's really less than 5%, so we have to ignore 5, and if it is 4 also we have to ignore. Okay, now in the case of third question, that there is a 70% pattern of 2. Okay, and now a 20% pattern 3 while 10% pattern 4. So over here, how can we solve this? We know that there is nothing in Gleason scoring pattern 2 and pattern 1, so just ignore pattern 1 and pattern 2 if you will get the question. So we will start our calculation from 3 and 4. So the predominant percentage is 20, so we will put the 3 plus 4 and the answer will be 7, right? So 7 is the moderate grade cancer, right? And over here this is low grade cancer, right? So just remember, like if you will find out pattern number 2 and pattern number 1, just ignore that and start the calculation from 3 and 4 and 5. Okay, if you will get any question related to the 5% less than 5% of 4 and 5, you have to ignore, still you have to ignore here. Okay, then in this condition we have to add the frequent one. The second digit will be a most frequent one and the first is a predominant one. Okay, so thank you so much for watching this video. Thank you so much.